Hello, and welcome to Top Notch Care Services Company Orientation. The purpose of this orientation is to familiarize you with the company's policies and procedures. Our duty is to deliver quality non-medical home care services to seniors and brain injury survivors. Our mission is to provide affordable home care services, offer flexible schedules for non-medical care, to bring homemaking and companionship services to clients' homes, and to serve the elderly and disabled communities. Our vision is to provide clients with outstanding home care services. Our caregivers, companions, and homemakers are responsible for upholding our company vision by satisfying our clients at every visit. Today's orientation agenda. First, we will visit the organizational chart, then the new employee paperwork, equal employment opportunities, confidentiality, cell phone usage, critical incidents, fraud and abuse, timesheets, late no-show policies, disciplinary actions, forbidden activities, performance evaluations, in-service and skills assessment, driving with clients, plan of care, universal precautions, and finally, COVID guidelines. The organizational chart. Rose DeRosier is the CEO and the founder of this company. Tanisha DeRosier is the Chief Operating Officer. Lacey Malcolm is Human Resources. Maglie Mercier, also known as Maggie, is the Scheduler. Quintessa Pierce is the Business Office Manager. New employee paperwork. You are responsible for submitting your new employee paperwork. You will need to complete the application, W-4, Connecticut W-4, your I-9, and also submit the proper identification that goes with it, your background check consent form, HIPAA notice, gifts policy, non-compete and confidentiality agreement, employee handbook agreement, your PPD and your physical results, and your COVID vaccination status. Please submit these documents promptly. You will not be able to begin working unless you've submitted all of your new employee paperwork. Equal employment opportunity. This company provides equal employment opportunities to all applicants. This means freedom from discrimination against race, color, sex, nationality, religion, age, disability, or genetic information. Confidentiality. Client-protected health information is confidential. As an employee, you must comply with the requirements of the Health Insurance Portability and Accountability Act, also known as HIPAA. At Top Notch Care Services, you will use client-protected health information in an honest, ethical, and confidential manner. Do not discuss the client's personal or medical information with anyone. Do not discuss your personal, financial, or medical affairs with the client or their family. Do not accept money or gifts from the client or their family. Cell phone usage. Cell phones brought to work must be on silent or vibrate mode to avoid disrupting clients. They may only be used during breaks and meal periods away from others. If cell phone use interferes with clients' care in any way, an employee's cell phone privileges may be withdrawn and disciplinary action, including termination, may be used. Do not make or receive personal calls at the client's home. Your family should call the office in the event of an emergency, and someone from the office will contact the client's home. Critical incidents, fraud, and abuse. What is a critical incident? Critical incidents can be classified as major or minor. A major incident is defined as an occurrence that results in physical injury, death, emergency treatment, prescription medication error, the client's location being unknown, the intervention of law enforcement, or abuse. A minor incident is defined as an occurrence that results in the application of first aid, bruising, seizure activity, and injury where no treatment is needed. What to do if a critical incident occurs. If there is an emergency, dial 911. Then immediately call a supervisor to report the emergency. Report the incident to a supervisor immediately. All incidents are expected to be reported, in your own words, to the supervisor no later than the end of the business day. A supervisor will review the report, oversee the investigation, and then follow up with you on the outcome of the report. If you find a reasonable cause to believe abuse, neglect, or fraud is occurring, that is enough to file a report. Proof is not needed. If there is no abuse, but the report was made in good faith, you will not be punished. Timesheets. In order to get paid, you will have to submit your timesheets. Your timesheets can be submitted manually or automatically if you use the electronic visit verification, also known as EVV. You are expected to clock in and clock out every time you visit a client's home. You should use the client's phone to do so. If the client's phone is not available to you, then you can use your own phone. To clock in using EVV, call the Sandtrax number. Enter your Sandtrax ID and then press pound. You will be clocked in for your work shift. To clock out, call the Sandtrax number, enter your Sandtrax ID, press pound, and this time enter the total number of tasks you completed, and then enter each task by its number. Then you can hang up. If you are unable to clock in or clock out using EVV, you are responsible for submitting your timesheet on paper using a top-notch care services flow sheet. You must submit the flow sheet to Quintessa Pierce, the business office manager, either by phone or email in order for your shifts to be included in payroll. Late no-show policy. You are expected to begin and end every shift at the time and on the day planned. You must inform your supervisor before the start of the workday if you will be absent or late, and also obtain their permission to leave early. Absences and late arrivals will be recorded. Should your absences or tardiness exceed a reasonable limit, you will be subject to disciplinary action and possible termination. Failing to call your supervisor or report to work for consecutive workdays will be considered voluntary resignation and result in removal from payroll. Disciplinary actions. It is crucial to top-notch care services success that you do your part at performing well. We take disciplinary matters very seriously and will conduct disciplinary action as we see fit. Disciplinary action may consist of anything from verbal or written warnings and counseling to suspension or termination. Try to use good judgment at all times. Review and internalize the list of don'ts below. Excessive lateness and or absence, improper or indecent conduct, uncooperative attitude, abuse, unauthorized use or unauthorized possession of company property, unauthorized use or disclosure of client information, possession and or use of alcohol, illegal drugs, weapons or explosives, illegal harassment and or discrimination of any kind, violation of company policy. Forbidden activities. We strictly forbid employees to do the following while at work: drinking alcohol or reporting to work intoxicated, selling, purchasing, or using illegal drugs, and possessing non-prescribed controlled substances, including alcohol and legally obtained prescription drugs. We care about the overall health and well-being of our employees. Top-Notch Care Services reserves the right to test employees for substance abuse, illegal drugs, and or excessive alcohol in your system. You are subject to disciplinary action. Any employee who feels that he or she is developing a substance abuse problem is urged to seek help. We will grant time off, within reason, for rehabilitation. Performance evaluations. Routine performance evaluations are administered every year. You will be evaluated on your job performance, reliability, attendance, communication, training attendance, and overall attitude. In-service and skills assessment. Employees are required to attend at least one in-service training every 2 months. And an initial skills assessment is required within 90 days of hire. You are required to complete and pass the PCA training exam. If you already have a license, then you are exempt from taking the skills assessment. Driving with clients. You cannot transport a client without giving and receiving written confirmation. In order to transport a client, you must first submit your driver's license, vehicle registration, and auto insurance policy to your supervisor. Your vehicle registration and auto insurance policies are not necessary if you're transporting a client in the client's vehicle, but your driver's license is. You are required to keep a log of all trips. If an incident or accident occurs, you are to report it to a supervisor immediately. Plan of care. You are required to understand the plan of care for the client on or before the first day of service. The plan of care, also known as the care plan, is a detailed explanation of services you will need to perform. The care plan will be explained to you by your supervisor before you begin working. If you do not understand the care plan or feel you cannot perform the services required of you, contact your supervisor before starting your case. Do not begin a case without reviewing and signing the care plan document. Universal precautions. You are expected to understand and follow the universal precautions defined in this section. Standardized training for personal care assistants for agency by Connecticut DSS states, follow safety techniques and good hygiene habits to stop the spread of germs and infections. To prevent the spread of infection and disease, do not touch a person's body fluids. Maintain a safe and clean work environment. Put waste in the right place. Use standard precautions and protective equipment to prevent spreading blood-borne pathogens. Germs spread from blood are called blood-borne pathogens. Wash hands frequently and correctly. Wear gloves, aprons, or masks as needed. COVID guidelines. All positive cases or exposures of COVID should be reported immediately. You are required to self-report any symptoms of illness prior to interacting with any client. If you have any symptoms of illness, you are required to quarantine away from clients until you are symptom-free. PPE, such as masks, face shields, disposable gloves, disposable gowns, and hand sanitizers are available for you when working with clients who have known cases of COVID-19. Thank you for completing the Top Notch Care Services Company Orientation.